Anti-smoking groups are calling for tougher legal action against passive smoking. This follows the case of a man who tried to get his apartment zoned no smoking after smoke drifted in from a neighbour. Dr Matthew Peters is a thoracic physician and chairman of Action on Smoking and Health. He says passive smoking is still a serious issue.
There are still people in the community who've got an undue amount of passive smoke exposure. We know there's no safe lower limit, so it ought to be eliminated where it can be.
So how close do you need to be to someone to be taking on, passive smoke?
As a rule of thumb, if you can smell the smoke, there's a potential for it doing harm.
And when you say a potential for it to be doing harm, how much of that smoke do you need? You can smell cigarettes all the time, but obviously if you're walking past, is that not an issue?
Smoke exposure, be it active or passive, is a risk. Sometimes that risk is manifest as a disease, whether it's lung cancer, heart disease, and others that risk is not materialised. So what we have to do is reduce or eliminate the risk.
Now, there's a possible case coming up of one man who's looking at taking legal action against his neighbours. He was in a block of flats who contracted lung cancer. How close or how easy is it to prove that you've contracted lung cancer from passive smoking?
I'm not a legal expert. Proof would be based on probability. I know the man, he'd had no active smoke exposure. He had no identifiable passive smoke exposure, save that was in his residential complex. That makes his case fairly unique and reasonably arguable.
But what about a genetic predisposition to lung cancer? Is that easy to prove then?
We understand genetic risk as it runs in families, but the details of particular genes aren't widely known. Probably the best way to think about it is that, like every cigarette brings cancer closer, so does passive smoke exposure. And no individual really knows how close that cancer is before they start.
And what is the percentage of people who have lung cancer that is directly linked to smoking?
What we know about lung cancer was incredibly rare 100 years ago. And the dramatic increase we've seen then is composed of a large group of people who have been active smokers and another group, and we'll never know what caused their lung cancer. In many cases it'll be passive smoke exposure, just we can't put a finger on where exactly it was.
So would you like to see tougher laws in regards to passive smoking?
I want to see the lowest rate of smoking reasonably achievable in the community. If we can reduce active smoking, then we'll reduce passive smoking too. But there are selected circumstances, I think, where this community's been very wise in reducing passive smoke exposure, where people are at great harm. We should continue that.
Dr Matthew Peters, thanks very much for joining us.
Great pleasure.